I remember everything feeling very dark, feeling very black and white, and feeling very helpless. For whatever reason, I believe that I was super depressed, very, very depressed. I was also at 9 and 10 years old. I knew I was different, not from just depression, but from being gay.
Yeah.
And so my MO was to be small, to be quiet, to hide, to get through it. Because I was just trying to be like, I'm not gay and I'm not depressed. To try to explain to people who haven't been depressed, I'd say it's like I understand fundamentally that a good thing could happen to me. Like I might win the lottery if I was depressed. And I go, this is good. I would love this money. This is awesome.
Right.
But do I feel excited? Do I feel happy? No, I feel like I want to go back in bed.
Hi, welcome to MedCircle's It's All in Your Head podcast. I'm your host, Jackie Colbeth, and it's great to be with you. Today, we are going to talk about childhood depression, struggles with sexuality, and how chronic medical conditions can all impact your mental health with our favorite MedCircle host, Kyle Kittleson. Kyle's first experience with depression occurred at the tender age of just 9 years old. At the same time, Kyle began struggling to accept his sexuality as a gay man, which also impacted his mental health. Kyle is an inspiration to so many, and we are so excited he took time out of his very busy schedule to chat with us. Kyle, welcome to It's All in Your Head.
Hi, Jackie. Thank you.
Great to have you here. I know our audience is going to be super pumped to learn more about you, your experience, and different mental health struggles that you've had in your life.
Sure.
Now, full disclosure, I know Kyle on a personal level, although I did not know Kyle during his childhood when he was diagnosed with childhood depression. And I'm hoping you can share with us a little bit more what that was like, because a lot of people assume the onset of depression happens in like puberty, 12, 13, seems very common, blah, blah, blah. And I'm fascinated to hear what it was like for you experiencing that as a child under the age of 10.
Yeah, actually, yesterday, Jackie, I went to go get a B12 shot at this doctor's office, and it was the same. It was the same office that my mom took me to when I was probably 8, maybe 7, when I saw a therapist for the first time. Oh, and I had never been there probably since I was 7 or 8. It was in the same building. But when I got there, I thought, wow, what a journey that has been, because growing up, I remember everything feeling very dark, feeling very black and white, and feeling very helpless, in spite of having 2 supportive parents, a brother that I got along with, school, friends, activities, all the things that on paper would mean a child shouldn't be depressed. For whatever reason, I believe that I was super depressed, very, very depressed. And my parents made the decision to put me on Prozac at 9 years old. And that really, I remember my mom would take a syringe of Prozac. It was liquid Prozac. And put it under my tongue. And we do it over the kitchen sink. And I'd have to spit out, like rinse my mouth out with water. And I hated the experience so much. And we did it, every day for 4 weeks. And I'm telling you, on the 4th week, it was like re-meeting all these people for the first time. Wow. I'm like, oh, hey, mom. Hey, dad. Hey, teacher. Hey, brother. Hey, friends. Like, I didn't know you guys were really around. Like, I knew you were around, but I didn't really see you. And man, I remember going into the doctor's office and they go, have you noticed any improvement? And I said, yes. And then my mom goes, oh, yes, major improvement, because I would cry at the drop of a hat. I would throw a tantrum at the drop of the hat. I thought everything was abysmal and terrible. And it was really rough for sure. But in some ways, you get it done early and you start learning management techniques early. True. And so in some ways, it was great. It would have been terrible. It would have been terrible if it had gone undiagnosed. Debilitating, terrible. So I'm thankful for the diagnosis.
Yes. No, definitely. And it's something that I'm wondering, does that run in the family? Like, I know depression can run. Did either of your parents, do you know, did they ever struggle with depression?
Well, so the answer to that is not to my knowledge and
Okay.
not to their knowledge.
Yeah.
However, I think a lot of people, especially older generations, struggle with depression and don't know it.
Yeah.
Because I grew up in a suck it up household.
Yep.
There was, oh my gosh, suck it up. You got problems, you got issues, suck it up. You hurt yourself, suck it up. Someone's making fun of you at school, suck it up. That was what I heard my whole childhood. And that's because my parents came from a generation where you just sucked it up.
Yes.
So if they did suffer from depression, I don't think anybody was saying, well, let's take you to a therapist.
I kind of envy that.
Yeah. They're just kind of like, get over it, you know? But I will tell you, I hope my dad doesn't mind me sharing this. My dad had a bout of depression in his life.
Yep.
When I was much older, this was just a few years ago.
Mm-hmm.
And he told me, he goes, Kyle, I always believed you when you said you were depressed. I believed it.
He did.
No question. But I couldn't empathize with it because I had never felt that way until he felt that way, until he couldn't, function like he normally would. Right. And that was actually very, that's probably the only time I've been happy to hear somebody was depressed because I was like, okay, you get it. Like you get it. Because if you've been depressed, you get it for sure.
Right. And it's unlike trying to explain it sometimes, like when I talk about depression or like nagging melancholy, I'll say to people, well, like, think of something you were sad about and then just be sad about it all day, every day with no real relief, but also no concrete reasons, as you mentioned, and that's kind of the mind F, if you know what I mean, is, well, outwardly, I've got a supportive family. I'm a smart kid. I've got friends. And it puts you in a place of, well, there's no reason for this. And then in come the shame, right? Of, oh, I'm ashamed I even feel this way because I shouldn't. And it can be especially with kids, it's hard to articulate. I found it harder to articulate myself when I was a young child. So it's definitely something I think that would breed, and I know it has with you, a ton of empathy and can really just help a lot of people.
Yeah, when you were just talking about having that shame come in. So you're depressed and then you're attacking yourself for being depressed.
Yes.
And then you're like, gosh, why am I attacking myself for being depressed? So really, you're attacking yourself for being depressed. Dr. Lamb and I, she's a psychiatrist out in California and one of the MedCircle doctors. And I forgot exactly what she called it, but it was something like, well, that's like a doctorate degree in self-attack when you're attacking yourself for attacking yourself for attacking yourself. But by the way, people listening to this will nod in agreement. We've all had versions of that, varieties of that. Even if you've never met clinical depression, I think we've all had, I'm attacking myself and then go, why am I attacking myself? Come on, Kyle, don't attack yourself. And then you're attacking yourself for attacking yourself.
Right. I remember friends going, hey, Jackie, take it easy on yourself. That's my friend you're talking about.
Yeah.
Yeah. And were you able to, and I don't know with the young age, I can't recall myself, but was there anybody outside your parents at that tender age that you talked to about this? I don't know if
no, not at all. I wasn't talking to anybody. I was also at 9 and 10 years old. I knew I was different, not from just depression, but from being gay.
Yeah.
And so my MO from, 16 years and younger, maybe even 17 or 18 years and younger, was to be small, to be quiet, to hide, to get through it. Because I was just trying to be like, I'm not gay and I'm not depressed. Right. Remember that, everybody. I'm Kyle and I'm not gay and I'm not depressed. Hello. And that was just my tagline. Not gay, not depressed. My name's Kyle.
I'm fine.
And the truth was I was super gay and super depressed. And so living a lie like that is an emotional toll. An emotional toll. Oh my God.
I can't even imagine just listening to different friends' experiences who taking the time to listen in coming out. It's 10 times deeper than, telling it to a straight person. It's definitely so nuanced. It can be a way for you to beat up on yourself, which I think is horrible. And Kyle and I were talking about this earlier. I was saying to him, well, it's not like homosexuality is a mental illness by any means, none of that is in and of itself. But I also have to imagine that when you're struggling with something like sexuality, that's such an innate part of you, something that in your bones. Was there anybody around, be it a friend, family, that you were able to maybe start talking to about that and opening up a bit to get some, reassurance and acceptance?
Well, I told my mom that I think I liked boys. Actually, I told my dad that I wanted to be a girl when I was probably 4 or 5.
Yep.
And I don't want to be a girl. I don't think I ever wanted to be a girl. I think that was how I was navigating the world as a young gay person, even at 4, 5, 6, however old I was, realizing, I don't fit in with like the boys at school, but I fit in with the girls at school. So maybe I needed to be a girl. Yep. Then I told my mom when I was probably 7, 8, or 9. I was like, I didn't say I'm gay because I didn't even have the words for that. Right. I didn't even know gay was a word.
Right.
And I was like, but I think, I like boys, or I don't know exactly how he told me and said it. And my mom said, you don't know what you like. And I said, okay, maybe I don't. Then I told my dad when I was probably 10 or 11, and I was just in tears telling him. And he later told me, he's like, well, yeah, I knew you were gay when you were like 3. And I go, okay. And then, but then even though I came out, and so to speak, to my parents that way early on, it wasn't definitive. I was more coming to them going, I'm confused, I'm sad, I'm scared, and here are the reasons why. And they were just like, well, basically we don't know. And then when I was 18, I came out to my friends in high school. And I came out to them actually knowing what I was coming out as now. Yeah. And then shortly after that, I told my dad. And then my mom had died. I never came out to my mother or my grandmother. But I told my dad. And everyone was fine with it. And you also have to remember, I got very lucky. Everyone was very supportive. Yeah. And 20 years ago, 25 years ago, it was not as easy as it is today. I don't believe, to come out. God, if I meet another high schooler going to prom, a same-sex prom date, I go, what? Aren't you afraid? I look at them, I go, aren't you afraid to do that? And they're like, what do you mean? No, it's like so just part of the culture now. Yeah. And I give the young kids a lot of hard times because they're not good at eye contact. They're too much time on their phones. They're obsessed with social media. I mean, to get them to say a sentence without using like or is almost impossible. But I will tell you this, they are progressive and ahead of the game in terms of inclusivity and acceptance of culture and identity. They really are hitting it out of the park there, I think.
Oh, hands down. I mean, I would have rather died than tell anybody I was struggling with my mental health.
But I get with the mental health thing for sure. And especially, Jackie, I think it's easier in a lot of ways to come out if you're if you're depressed.
Yes.
Because everyone's heard of it. It's the second most popular diagnosis in the manual. Yeah. Bipolar disorder, much more rare. Yeah. Comparatively. And so much more stigmatized, much more misunderstood. So of course people would feel hesitant to come out with that.
Oh yeah. Until I met my first millennial. And they were like, I'm bipolar. They were just, it was loud, it was proud. And I'm over here as a reaction going, shh. Hey guys, you're kind of letting that out of the bag and putting it on blast. What's wrong with you? Are you nuts?
Yeah. Yeah.
But I was so bowled over with just admiration and respect, to your point. No matter what I think of your social skills, what I do think of your empathy and your EQ, they have such a high EQ, and I literally just, applaud them, whether it's homosexuality, mental illness. They're very, very open, and they will talk a lot about it, which I think is something that we need in order to talk more. Now, you've mentioned your mom. For the audience, Kyle's mom was the classiest woman I have literally ever met. You can call my parents and ask them when I had first met her as a teen, and your grandmother as well, her mother. I wish I could portray to the audience just what a stunning, classy, caring, amazing woman you had for a mother.
Oh, I mean, I'm obviously biased, but I mean, runner up to Miss Oklahoma, from the South, elegant, I think I don't have any recollection of her ever having a drink in her life. She drank tea, she was just, and she was my best friend. And I've never, maybe there's one person in my life I've laughed as hard with, but man, my mom and I would just laugh and laugh. I mean, that was just, it was, the joke in my family was, it was me and my mom and then my brother and my dad. And that was like, if we went on vacation, I went wherever mom was going and he went wherever. Yeah.
Yeah. You kind of go to your corners, I think that happens a lot too, but I know what an unbelievable person she was overall. And I remember my mother saying this after her funeral. Sadly, she had passed. After her funeral, and me and my family attended, I will never forget it. We got back in the car, very, very solemn. It's just such a loss. And my mother said, I will never, ever have that many attendees saying that many nice things about me when I go. Well, part of me was like, yeah, I know. Sorry, Mom. I
was going to say, that's not true. That's
not true, Marg. It's not true. No. But I do also remember that. And I cannot fathom how difficult it was to deal with that. Can you give the audience an idea of just what it is like to navigate that level of grief?
Really well executed question. I remember a time I was a freshman in high school and I was talking to my friend in math class and they said, have you done any drugs? And I said, no. And they said, would you do any drugs? And I said, no. And then I said, well, actually, if something really bad happened, like if my mom died, I would probably just give up and do drugs. I remember saying that. And then coincidentally, 2 years later, she ended up dying and I didn't go use drugs, but I just used that as to illustrate what even the idea at the time of losing my mom meant for me. To me at that time, it meant fully giving up in life. Without my mother, it was almost like there is no point because she was, for me, everything. So to lose it, the grief was complex because I still think however many, I was 16, I'm 37. So we'll call it 16 years. Is that 16 years? I don't know. I can't do math. No, more than that. Anyway, what is that? 20 years, 21 years? Has it been 21 years?
16, you're 37, 21 years.
21 years. Wow. So 21 years later, I'm still grieving this. Right now, I could either start crying or keep it together and do the interview with you. That's how fragile I am sometimes when this comes up. I keep no images of my mother anywhere. I don't have them on my phone. I don't have them in my house. There's a picture of her in her wedding dress hung up in a secondary closet that I go into a few times a year. That's the only time I see an image of her. And that's on purpose because to me, they are triggering events that bring up all of this emotion. And I can already hear I brought this up with Dr. Lamb during one of our workshops for MedCircle members. And it is unprocessed grief. It is unprocessed grief.
Yes.
I was 16 when she died.
Yeah.
I buried it fast and hard.
Yep.
And just went to the next thing, and I don't think still have really ever dealt with it the way a therapist would maybe advocate for me to deal with it.
Sure.
I put it in a little box and put it away. And I'll also say, personally, I don't think there's anything wrong with that. I don't know if there's a wrong way to grieve.
Yes.
I think you can do it however you want. You know, when my grandmother was dying, I was sitting with her at her bed trying to comfort her, and my brother was playing poker. And it's not because my brother is bad or wasn't grieving or wasn't sad. It's because that's how he decided to deal with it. Exactly. And there's nothing wrong with playing poker if that's the distraction or the way you need to deal with it. Yep. And so we all do it differently. It was terrible. It still is terrible. But I will tell you this, time heals all wounds. I believe that. It is easier today, obviously, than it was 21 years ago. And the grief is also very understandable. Yeah. It's very understandable. You know, you interviewed Austin Hamilton on your podcast, who struggled with porn addiction. And he's a friend of mine, and he wouldn't mind me sharing this because he's shared it publicly. He might have even shared it on your podcast. But he said he lost his mom when he was 5 years old.
Yes.
And he was in therapy as a full-fledged adult, married with kids.
Yes.
And the therapist was like, did you have any trauma in your life? Or I don't remember exactly. I think they said, did you have anything bad happen to you when you were a kid or something? And he goes, well, yeah, my mom died in a plane crash when I was 5. And then he said, that hasn't impacted me. I'm fine. Which cannot be a possibility. No. A child to lose their mother will have an impact from that event. And I think I brought that up just to show that a lot of us grieve differently. There's no right or wrong way. And when you have so much time pass, you do get into your own regiment of how you cope and deal with it. And so while part of me goes, no, I should go to therapy and figure out what my grief is so I can have pictures of my mom up around the house. Or I'm just not going to have pictures up of my mom around the house.
Right.
Like, just let me live, you know? And I think there's some power in that. There's no right or wrong way to do this, y'all.
No. And I'm glad, and to reiterate that there is no right or wrong way to grieve. I would often, if we've had a family member pass, I don't want a remnant of them.
Yeah, and we even talked about this with dogs.
We have, even, you know, and not to trivialize it, comparing it to a parent, but I will go through and this drives my mother nuts because she's convinced it's, you know, just a bad way to go in her head, because her way of dealing with it is to create like a monument with photos. And I say, you know, good. I would not be able to function really. Like if I had a constant reminder, I know the way I'm built, I just don't know if I could keep it together the same way she keeps it together. So we've had a lot of ongoing debates when I'm throwing everything out or putting everything in a closet and you come over and there's like not a remnant. It's not because I'm not sad or devastated. To your point, that's my way of dealing with it. And I just don't see, as much as I love therapists, sometimes I just don't know if you can retrain someone, you know, force them through therapy. And all of a sudden I'm going to be walking around with photos everywhere of everyone I loved who's passed. I just don't, I just don't see that. Yeah.
There's 2 great series by MedCircle on grief with Dr. Judy. And understanding the stages of grief, I think, are really important for people, but also remembering that they don't go in this order. We're like, here's how you feel, honey. You feel this way, and then this way, and then this way, and then you go back to feeling this way, and then you feel this way. But understanding the stages of what those could be, I think, are really impactful. This is the other thing, Jackie, is talking about mental health for me. This is all I do is talk about mental health.
Yes, it is.
All I do. And when a lot of my non-MedCircle time is spent talking about mental health because people are like, oh, I have this question about mental health, or I want to get your thoughts about this mental health topic because that's my job. And so I probably have the largest toolkit of strategies and tips and exercises, and I have a better than normal understanding of grief and depression and what are all these things. And so it has helped me navigate all of these things. Yes. Even today, I'll give a very simple example, but so powerful if you can do it. Today, I woke up and I was a little more tired than normal, and I didn't feel like maybe I was in the best mood.
Sure.
But because I've had all this experience and education from these amazing doctors, I can really identify very quickly, like, oh, but you didn't get a lot of sleep. Yeah, and you didn't really eat healthy, and you're probably a little dehydrated, and it's not this and it's not that. And you start to realize where your mood actually is coming from, where the old Kyle prior to all this would be wake up and go, I don't feel good. Well, this sucks. Shoot. Now I don't feel good. So I'm probably not going to feel good all day. And how am I going to get all this work done if I don't feel good? And you start spiraling and spiraling and spiraling.
Yes.
Yeah, I don't spiral. I don't spiral anymore.
It's good.
And just because I understand.
That's awesome. You bring up something I was thinking about last weekend. My family, my brother, his wife, and my niece were in town. She's about 2.5 years old.
Oh, yeah.
And you know what 2.5-year-olds get like if they don't nap, get their like midday nap. I mean, you know this.
Yeah, if I don't nap too, but yeah.
Well, thank you. Your head is where my head was at. So she has full-blown meltdown, right? Like full-blown, hands flying, like complete meltdown. And she doesn't know she's tired. She doesn't have that insight yet. And I look at my brother and I go, well, I mean, I have a version of that as an adult when I don't nap, when I'm tired or I'm hungry. You know what I mean? I go, but as adults, we can at least pause. And I always go back to, I didn't retain a ton in rehab. Okay. But I retained enough to keep certain things in my head. One of them was if you're feeling kind of funky or like I wake up and I'm just like, today might not be a banner day. I don't know. It's halt. Hungry, angry, lonely, or tired. And it is usually one of those things, if not a couple, that are really contributing kind of to like your inner discontent, if you will. Yeah. And to this day, well, now every time I feel weird, I'm like, don't wig out like your niece. Don't start throwing stuff and getting hangry and causing a scene. But it just really highlighted for me, I don't care how old you are, I don't care how young you are, when your body is telling you something, you might not know exactly what it's telling you, but you should probably try to figure out, what's going on.
The body keeps the score, as Vessel, I can't remember his name, Vanderchuck. Anyway, some guy way smarter than me wrote a book, Body Keeps the Score, must read for anybody who's alive. And your body's always telling you what to do. And if you don't listen, your body will just tell you louder and louder. I became obsessed with sleep over the last probably 2 years, learning about it, understanding it. And this is something I think listeners might find interesting. It is a concept called polyphasic sleeping. And there's three, I'm not an expert on this, it's just what I read. There's 3 different types of sleeping. There's monophasic, biphasic, and polyphasic. Most of us are on monophasic, where we sleep for a portion of the 24-hour period. We go to bed at night, we wake up. Some of us are biphasic, and a lot of countries are biphasic, or different cultures are. So you'll sleep for a large portion at night, and then you'll take a nap in the middle of the day. And then babies and how we're born, we're polyphasic, where we sleep on and off during the 24-hour cycle, just as our body needs it. But we move babies away from polyphasic sleeping to monophasic sleeping as quickly as possible. And all I hear are parents about trying to get their kid to sleep through the night. And all those things. And there is an argument that we are meant as a species to sleep polyphasically rather than monophasically. And there are people out there who sleep polyphasically, where they will sleep for 20 minutes every 2 hours for a 24-hour cycle.
Come on.
They are awake for 40 more hours during the week. They are not tired. In fact, they are incredibly energized and feel rested because their sleep is so efficient. Their body has learned, all right, we get 20 minutes to crank it in for the next 2 hours. So they go to sleep immediately. They go right into deep sleep, and then they come out 20 minutes later. I only say this to express the necessity of getting your sleep under control if you're going to tackle your mental health issues or anything. It's number one for me. I think most of our doctors would say it's number one, number two for sure. Yeah. You know, it is the thing. If you can't figure that out, everything else is difficult, more difficult than it needs to be.
Right. So I can imagine tackling anything that has to do with sleep would be definitely worthwhile. And I think there's lots of different things.
Well, we have a great series with Dr. Judith Joseph, a psychiatrist out in New York. And we did a whole series on sleep and the intersection of sleep and anxiety. And yeah, I mean, if you've never heard the phrase sleep hygiene, you got to go learn that. I thought that was just taking a shower before you go to bed, but it's the whole method about getting your body on a routine, getting it triggered for sleep, getting it to go into better sleep. It's not about getting 8, 9, 10 hours. It's about getting great sleep. And, anyway, I could go off and off on sleep, but
no, that's fascinating. There was a book called Why We Sleep.
Oh yeah. It's on my nightstand right now.
Okay. Yeah. And but here's the thing. When I read a book in bed, I fall asleep.
Yeah. Well, okay. So I just did an at-home sleep test and I have sleep apnea. And so I go into
those tests.
Oh my gosh, it's so easy. You wear a cap for 3 nights in a row, and then all the information virtually gets sent to the doctor, and then they tell you if you have sleep apnea or not.
Oh wow!
And I stopped breathing on average 10 times a night, which is or 10 times an hour, which is the lowest. Like it's like minor sleep apnea. But anyway, as a joke, you reminded me of this. I go into the doctor's office. They're like, "How are you today, sir?" And I'm like, honey, I'm tired. Like,
you got my results. You know,
yeah. I'm at the sleep clinic. How do you think I'm doing? I'm tired here.
No, definitely. It is a component, and I think it's super important to include all the components because honestly, I wouldn't have known that. I would think like, oh, your mental health is just all these chemicals kind of bouncing around. You're at their disposal, you know. So, even looking into something like that, to your point, was sort of our generation was probably a little later in the game to really highlight how important that is.
Yeah.
Now, I don't know if this is a particular case, but do you think that, I know you were diagnosed with Crohn's disease. Mm-hmm. What happens when you have something like that? How do you see that sort of playing into, or did it trigger your depression? I imagine that's obviously, I have friends with this. It can be difficult and frustrating and painful. So I'm definitely wondering if upon that diagnosis, was it sort of like, okay, I gotta, work even harder. This is kind of bumming me out. I'm wondering how that, fits into the whole grand scheme.
Well, when I was diagnosed with Crohn's disease, I didn't even have time to acknowledge any depression that was going on. It was so overwhelming that it was all I could do. Yeah. I was diagnosed in 2005. Right now I'm 6'1". I weigh 170 pounds.
Yep.
At 6'1", the same height, I weighed 94 pounds.
No.
I was in the hospital. I was just skin and bones, hooked up to a tube for like nutrients to, keep me going. And so when you're dealing with all that, you're not like, you're depressed because you weigh 94 pounds and you're supposed to not weigh that. I think the big takeaway there, not to bring it back to sleep, was there is a correlation between stress and sleep and my Crohn's. If I get 4 hours of sleep, I can almost guarantee you that my Crohn's is going to flare up in the morning. Almost as a guarantee, I can tell you that. If I'm really stressed out, it will also have a more higher likelihood of flaring up.
Yeah.
But the one theory that was floated around my doctors, and I actually believe it, is that I held on to, I hid myself from being gay for so long in so many different ways from everyone in my life. Okay. So I was playing, or I was acting to a degree with everybody in my life. And that amount of stress, I think, triggered the resurgence of Crohn's disease.
Yeah.
Now, I don't know if that's true. I'm not a doctor, but it just makes sense to me.
Yes.
And I'm not saying I wouldn't have these symptoms of Crohn's if I wasn't gay or if I had come out earlier, but they might have come later, or they might not have been severe when they did show up, because they were as severe as symptoms for Crohn's can get.
Did you ever have at any time after you mentioned you were prescribed Prozac, when you were entering therapy for childhood depression, has there been any instances over the years where you felt like, oh, this is kind of creeping back? Like it's been okay.
Yeah.
That's my curiosity.
That has happened 3 times in my life.
Okay.
And let me tell you this.
Yeah, please.
Those 3 times where I've had what I consider a relapse in depression, and so did my doctors.
Yeah.
It was all correlated with me going off my meds. In my 20s, I didn't know better. And so I'm feeling good. I'm, broke. So I don't want to go spend another $60 for another whatever, month of meds or whatever it was. And I'm like, I feel good. I can do this. And you, when you're not depressed, you feel like you can do stuff, So I'm like, I can do it.
Well put.
And then I got off the meds and fine for a while. And it's that sinking feeling that creeps in, and it's very subtle. And when I feel it, I go, no, I can't do this. No, we're not going to do this. Yeah. And then day by day, it gets worse until it's like a disease moving through your body that shuts your whole body down. Yes. And I always, to try to explain to people who haven't been depressed, I'd say it's like I understand fundamentally that a good thing could happen to me. Like I might win the lottery if I was depressed. And I go, this is good. I would love this money. This is awesome. Right. But do I feel excited? Do I feel happy? No, I feel like I want to go back in bed and I want to close the blinds. And I have the stereotypical depression where I'm like, just put me in a dark room. And it came back. So one time I was just driving around aimlessly in Florida when it was really bad. I didn't even know where I was going. I don't know anything. And my dad called me and he's like, what's going on? And I broke down and I got into a therapist. Another time I left the dentist. I was in the chair at the dentist office and I was like, I just started crying. I'm like, I got to get out of here. And they're like, honey, it'll be okay. I know you're scared of the dentist. I'm like, I'm not scared of the dentist. No, I'm having a full blown breakdown. And I just went into my car and just cried in my car. And I found a same day psychiatrist in Beverly Hills. And I go see him at like 9:30 at night. And he's on this like top floor penthouse office thing. And I'm thinking, all right, I'm seeing a really good guy here. And I come in and I'm crying and like barely talking. And he was terrible, Jackie. Like when I tell you, he's the worst experience I've had with a mental health provider. The only things he told me is how many celebrity clients he has and offered no support, no next steps, no information, no guidance, nothing. Was just, anyway, I can't go to it. So that happened another time. So yeah, the relapses happened. But let me tell you, after the last relapse, I have not gone off my meds and I have not had a full blown relapse. I get depressed in May and June every year. I don't know why. I've talked to doctors and they think this is not a thing, but they call it reverse seasonal depression. It's not a thing, but that's what they call it, refer to it as. And there are lots of theories on why May and June specifically has this trigger to depression.
Yeah.
But it's very manageable depression. It's not like I can't function. So,
recovery, whether you're depressed, whether you struggle with substance abuse, it is not linear. You
no.
don't just, get better once and then you good.
Yeah.
Like it doesn't work like that. And I think that I know my experience and I've had crap doctors and I've had amazing doctors, right? They're kind of like the general public. I don't advise worshiping a psychiatrist by any means, but I certainly can tell you, much like salespeople, there's good ones, there's bad ones. And hopefully, you are able to find someone you're comfortable with that you trust. I know for me, that's always kind of been a relationship I struggled with, the doctor patient, if you will, because I always felt very disempowered, kind of like they're on high telling me what I need to do and I can't question it. And I just kind of have to take the pill and suck it up. And that's not a great feeling. But I think it's important too to know, medication can absolutely help. It has helped me. I can say that on a personal level, but I also think too, I'm big on realistic expectations because that's when I believe people become like elated or disappointed. And I really appreciated it when a psychiatrist I was seeing was like, Jackie, at any given time, if this medication makes you feel weird, if it doesn't make you feel good, then it's either not the right dose or it's not the right medication, but you need to stay communicative with me in order to have you not feel like crap, because that's not the goal. That's not the goal of medication, is to make you feel like crap. So whether it comes and goes, I've had to tinker with my antidepressant dosage. So for me, I take Lamictal twice a day, every day. And that's actually an anti-seizure drug. But when used in a low dose, it can treat bipolar 2 depression. Game changer. Love it. What I have to tinker with over the past 20 some odd years is the low dose of an SSRI. So sometimes if I'm with you, I start to get that feeling like something's not entirely right. Like now I just go to the doctor and we can make adjustments. But at the same time, I've come to an acceptance that, no matter what I take, this is something I'm predisposed to. So at any given time, if I start to feel not great mentally, that's something that is probably never, ever going to really go away. It's just more what I do about it. When I get that feeling.
I think what you're describing is a great example of a form of radical acceptance. It's not as though you accept your feeling of depression. You accept the fact that you will have feelings of depression.
Sure.
And there's a lot of peace that comes with that. I struggled for a long time thinking, well, I'm never going to get off these depression meds.
Right.
And I probably won't. And I can radically accept that. And it's a little easier too, because I'd rather be on the meds than be depressed. So that's an easier choice.
Absolutely. I tell people, you better put my meds in my coffin, because if there's an afterlife, you're going to want me to have those. Okay.
I need 40 milligrams of Prozac, please.
Tuck it right in my casket. That's kind of the motto with me. But, Kyle, it has just been so awesome getting to have this conversation with you. Like I'd mentioned, our audience adores you. I know this. You've been at this for years. And I just want to thank you again for taking time out, definitely of your busy schedule. I know his schedule. It is quite busy. To talk to us about this. I just know that so many people are going to get so much great stuff out of it. You're open, honest assessment is priceless. And I just can't thank you enough for coming on and sharing that with us. Even I learned some new stuff about Kyle today.
Well, I appreciate it too. And there are no shortage of these stories. My story, while unique, is not uncommon. I get so many emails from MedCircle viewers specifically who feel comfortable enough sharing part of their story. And I always appreciate it. Sometimes they're just sharing. They're just like, hey, I'm just telling you what I've been through, what's going on.
Yeah.
And how many times do we hear we're not alone? Goodness gracious, I hear it all the time. Sure. But the reason we're hearing all the time is because it's so freaking true, y'all. You're not alone. Every single person, every single human being is doing something, is going through something. That's why I end every broadcast with whatever you're going through, because that applies, because we're all going through it. And so I really thank you for giving me an opportunity to come on to be interviewed by you. And I think the viewers who watch MedCircle, whether you watch on YouTube, whether you watch at medcircle.com, whether you're a member at watch.medcircle.com, whether you've downloaded the app, wherever you get your MedCircle, like you guys, you all have changed and influenced my life so much over the last 6 years. And I appreciate your stories, and I wish we could tell all of them. So don't be afraid to tell your story too, if you ever come across that. That's so powerful.
Yeah, at least someone at MedCircle is always listening or reading. We love our audience. We're very tight with them. And I'm happy that you're encouraging that, because sometimes you feel like you're screaming into an ether, or no one else, is going to say, hey, you got this, or hey, I get it. I've been there too. So as we end every podcast, we ask our esteemed guests, if there is someone out there right now who is struggling, whether it be depression, whether it be with grief, whether it be with any medical problems, what would be your advice to the person who is watching this and is really deep in the struggle right now?
Well, I'm going to give two pieces of advice.
Please.
And I'm going to give practical advice because I have asked this question to virtually every doctor who's come on our platform on a variety of different topics. And so I'll give two pieces. The first one is you need to get educated about whatever this is. Think about the last time you made a big purchase. Maybe it was a TV, maybe it was a car, maybe it was a new shirt. Did you go Google the specs on the TV? Did you go look at a few different TVs? Mm-hmm. Probably by the end of it, you were kind of like a TV expert. You're like, yeah, there's this one and this one and this one, and here are the different prices. And if we wait till here, we can get a discount. And this one has streaming capabilities, and this one will fit in our living room. You researched it.
Yes.
For a TV.
Yes.
So if you're going to spend that amount of time on an item, spend at least that amount of time on yourself.
Yeah.
And I'm yelling only because I'm yelling at the old Kyle. I was diagnosed with depression when I was 9 years old, Jackie, and I didn't learn even the definition of depression until I started at MedCircle. I had probably been through years of cognitive behavioral therapy, but if someone asked me what CBT was, I would have been like, is it like a BLT? I don't know. I was so uneducated.
Right.
That is the first step. Yes. If you wouldn't go buy a new car without researching cars, then you need to go research your depression, your grief, your trauma, your bipolar disorder, that relationship you're in, why you keep dating the same man over and over again, why you can't connect with your mother-in-law, why you can't get your child to tell you the truth, why your child isn't listening in school, why you and your husband have the same argument, why the medication isn't working. You need to research it. You need to go learn. Okay. That's number one. Number two is you don't need to do it by yourself. Fine. 2 years ago, we did a mental health month, and I only interviewed people who had lived experience in mental health. Number one feedback out of that whole month of interviewing people with lived experience, they said, you got to find your community. And it can be online. It can be virtual. It can be one person. It just has to exist. So find that support, find that community. Right. Get educated, find the community. And I'm saying that, obviously, I hope you do it with MedCircle because that's what we're designed to do.
Yes.
But however you do it, do it. Okay. If you need to go read a book, read a book. If you need to go call that old high school friend, go call that old high school friend. Just do it. Do it. I can only just yell it as loud. I can only repeat it so many times. Do it. Because I did it and it changed everything. And I didn't do it for decades and nothing was changing.
Yeah.
So the missing piece is the understanding, the clarity, and peace. The missing piece is peace. And that peace comes with the understanding and information and clarity. So get educated.
Yeah. Knowledge is definitely power. Yeah. And to your point, it can be quite freeing when you become smarter. And to your point, something's happening to me. I would hope I would strive to be the smartest damn person on the subject if it's certainly going on in my brain.
If you have that thought, I'm not good enough, know where that comes from.
Yeah.
Be mindful of how often you're saying that to yourself.
Right.
Be mindful if you actually believe it. Be mindful if you're beating yourself up rather than giving yourself constructive criticism. I mean, I can go on and on with examples here, but be selfish. Be selfish and learn about yourself. We preach, we all grew up, be selfless, share, care for others.
Yep.
I'm telling you right now, put that aside for just a minute. Focus on you. Be selfish about you.
Yes.
Be selfish about you. That is how you do all these other great things for other people. That is how you show up and care for other people and make a difference. But if you're not focused, and I'm really talking to moms out there, y'all are the worst at this. You are not selfish. Moms are not selfish.
That's true.
Moms are selfless, and they're selfless to everybody. They become a mother and they're like, all right, my life is for everybody else now.
Yes.
It's still your life. Be selfish. Get educated for you, and your life will change.
I can't think of a more perfect note to end on. That is some sage advice, my friend. And thank you again. I hope you come back. I'd love to continue this.
Yeah. Hey, I
know
love
where to find you.
Yeah, exactly. Yeah, I'm easy to get. I'm easy to book.
Awesome. You're the best, Kyle. Thanks, buddy.
Thanks, Jackie.
Thank you all for joining today's conversation with Kyle. If you visit MedCircle.com, you can access tons of other conversations, including weekly workshops with our credentialed doctors, an award-winning video library featuring almost 1,000 educational videos. Become a member of our community today. Visit MedCircle.com to learn more. And thank you for listening to It's All in Your Head.